Okay, so here we are going to be using a cane or a stick. In this case, it's a wand for blinds. Whatever you have handy, broom handle. So you want to think anything you can use that's somewhat smooth and somewhat comfortable. You don't want to feel like it's digging into too much. But this is to aid in forward flexion, to be able to better perhaps reach your shoe, sock, if you're having difficulty with that. It also will enhance the ability to lift the leg. So if you're noticing restriction here and difficulty or stress, strain that's excessive or causing discomfort, that can be a problem. So we're going to take that. I'm going to go onto one side. I'm going to slide it up my thigh. I'm going to come under any soft tissue that might be in there, okay? So you want to be kind of on the front of the pelvis. You can't really see that very well, but kind of right up here, just under my belt line, okay? And so what I can do there is I can just kind of let that kind of sink in and kind of guide my pelvis back. And as I'm doing this, I'm thinking about those wings for my lower spine here, the lumbar spine. I want to push those back and push the wings up here forward. I don't want to collapse up here. I want to keep that back nice and neutral, straight, and it may be just a little subtle little rounding of that low back. Now you can also bring it up on your tummy here. Just make sure it's not too painful and uncomfortable, and try to guide that and not force it. Guide it into that stretch, okay? You can roll over that, around that. Try not to collapse too quickly or too much up here. Try to get more of that stretch in that low back, and do it on the other side as well, and see if you notice a difference. You might feel a stretch going the opposite way on this other side here as well. But just try to note, take note if you're reaching for your toes on each side. Can you reach, or is it too difficult or restricted, okay? But we gotta think about the mechanics of this, like bending the elbow. Everything has to pull back and out of the way here because this has to close down. So everything's pushing back through here to the convexity. You got to clear space in the concavity because it's closing down. If something's in the way, it's going to block it, including your tummy. So you got to be able to pull that in, stretch tall, get it out of the way, and also pull it back. And your pelvis has to roll back here too. So we got to get that to pull back and roll back. And then those vertebrae, those wings have to pull back as well as you pull in the tummy, and then stretch. And then see if you can better reach. And then also see if, as you hold yourself up, if you can more easily lift your leg. So just right there, I can feel a difference, that it was a little tough to lift my leg and now it's easier. So that's kind of nice too. And then we can tie that right into our core abdominal exercises, core exercises, oblique exercises. Because if that's too stressful, strenuous, you might actually overwork and strain your hip flexors, which might actually make them tighter, and some of them attach to your spine, and might pull your spine forward, and that would make things worse especially if you have low back pain. But also it would lock you out from being able to flex. You want to be able to get a subtle rounding and stretching in that low back, open that up to be able to get that up. And even you can use your hands here once you're able, or lying on your back, to enhance that even further. But you got to start somewhere, and that wand can be really helpful as a guide, and it should be comfortable as you do so.